Hi, I'm Dr. Jeff Waldron, and like many of us right now, we're noticing that chronic stress is really affecting our bodies. So if you're somebody right now who's noticing you're a little stressed out and it's creating tension in your body, then this is a good video for you to watch. The things I'm going to touch base on are how it affects your body exactly. I'm going to talk about a specific nerve in your body called the vagus nerve and how to regulate that nerve to help reduce the stress. And then I'm also going to show two specific exercises that you can do easily at home without any equipment in order to regulate and kind of reset your nervous system to help calm down after you've had a stressful period or something that's been impacting how you're feeling with tension in your body. So the first thing I'm going to talk about is how this stress starts affecting your body. When you get stressed out, you start to get inputs coming from your brain, going out, down through your body, and you can see with my skeleton here, there's this red tubing here that's supposed to represent the vagus nerve coming off the brainstem. It runs all the way down through the esophagus, going to the heart. It goes also to the stomach, to the lungs, and to several other internal organs. So when this nerve is activated, you start getting increased stress and clenching of the muscles of your stomach. This can tighten up and create stomach pain. A lot of us that have been stressed out have noticed our stomach starts to get a little tensed up if you have a big exam or test, or you've been watching something on the news that's making you a little bit stressed. This nerve is giving all these inputs to the muscle, turning it on, just like if you were to flip a light switch and turn on a light bulb. This nerve is turning on those muscles and causing them to contract. When they contract, the stomach and esophagus can get pulled up into your diaphragm, which is your big breathing muscle. That pressure up into the diaphragm then can cause you short of breath, make it difficult to breathe, and make it even worse with some of this compounding some of the stress that you're already feeling by making you breathe more shallow and also giving you this additional stomach pain. So if you're feeling something like this, there are some exercises we can do to help with this. The vagus nerve that I'm pointing out here, it mostly gives input up into the body. So it's got this 80% what we call afferent nerve activity that's arriving and only 20% outgoing. So if we give it really positive inputs after we've had a stressful event, we can make ourselves feel a lot better, reduce the tension in your neck, calm down your stomach, reduce some of these like hiatal hernia or reflux issues because you have this sliding hiatal hernia going on in here along the diaphragm through the opening in here. So this vagus nerve is just like any other kind of automatic nerve in our body. We have this autonomic nervous system. If you go to the doctor and they have a reflux hammer and they're checking your reflexes, they can come in and hit and you're going to have this automatic response. This vagus nerve also, if your middle brain is telling you there's danger, there's stress, it starts sending all these signals down, making your heart race, making you breathe differently, tightening your stomach, and we can regulate that with these exercises and make yourself feel a lot better, reduce pain that's occurring from muscles that are tensing excessively in your body. So your neck is tense, your stomach's hurting, you're getting back pain, or you hold stress in different ways in your body. You can go in, exercise some of these nerves off your brainstem called cranial nerves and calm down those muscles. Since that nerve goes down and turns on the muscles, if you all of a sudden change that input, just like the light switch, now those muscles relax instead of trying to stretch out and aggressively fight with a really mad muscle because it's getting all this signal that there's danger from the nerve. Just change the signal and your muscles will relax. So here's two exercises you can do, and these come out of the polyvagal theory that was developed by Stephen Porges and Stanley Rosenberg. These two guys came together, Stanley Rosenberg with the exercise, Stephen Porges with the theory of the polyvagal, which is that there's three vagus nerve systems. So I'm showing one right here, but there's that fight or flight, which is the one people really know about, the sympathetic. There's also this dorsal vagal state, which is shock. So if someone has something so bad they shut down and they're just in shock after a trauma. And then this third state, which he references as social engagement. So this is when we're functioning well, we're smiling, our eyes are bright, we're engaging other people. And these exercises are designed to move you into that ventral state of vagus nerve so that you can engage individuals and feel good and get rid of some of that tension and pain in your body and feel better. So here's the exercises. I'm going to go through them. You're usually lying on your back for this first one. You take your fingers together and you lace them like this, and then you're going to put them at the base of your neck, just right here along your suboccipital muscles. And you're going to hold this position lying on your back. What this does is it activates your 11th cranial nerve, which is your spinal accessory nerve that creates these tight muscles in your neck. So you're going to hold this position, and then you're going to simply just look with your eyes gently for 30 to 60 seconds. Now remember, you're lying on your back with this. You look for 30 to 60 seconds, no head movement. My head is nice and still, it's only my eyes moving. At the end of that 30 to 60 seconds, you should feel like a sigh, or you can do a yawn, so you just go ahead and yawn. And that yawn, what that does is it activates other cranial nerves. So I'm going to do the other side, so you come back straight, and then you do the other side. 30 to 60 seconds. At the end of that, you're going to go ahead and take a deep breath, a sigh, a yawn. And then you can come up back and rest. You can repeat this several times throughout the day. That yawning activates these other nerves. We're activating our trigeminal nerve, which is the 5th cranial nerve. We're getting our facial nerve that allows us to smile and move our face. The eye movements, activating this oculomotor nerve, and also helping to activate some of these small muscles in the back of our neck called suboccipitals. The swallowing and moving is activating our glossopharyngeal, which is our tongue nerve, which is the 9th cranial nerve. And then the swallowing or the yawn is also activating this vagus nerve we're talking about. So now we've just kind of given yourself a reset by doing this very basic exercise, which is what Stanley Rosenberg calls it, is a basic exercise, just getting in this position, looking 30 to 60 seconds, yawn, looking straight. Everybody's getting sleepy now. All right, look the other way, yawn, and that's effective. After doing that, now the stomach should calm down. We could do some gentle massage to kind of pull down on the stomach and not have that stomach jamming up in the diaphragm, so then you can breathe better. So you can do a little gentle skin traction, pulling down on the left side of your abdomen, just underneath the ribs here, to pull on that esophagus and help that out and reduce some of those hiatal hernias as well. This is also helpful to regulate some of the breathing. If you're going to go in, you can work on some of that diaphragmatic breathing I've talked about in different videos, or you can do this other exercise we usually use for the jaw. This is quite effective for the vagus nerve as well. You just get in and rub your stomach, just doing little circles like this. After you do 10, 15 reps of circles, you come up and you're going to go ahead and rub on these suboccipitals in the back of your neck. So now you're stimulating more of those nerves that are flowing out through your system. You're doing those efferents, setting signals up to your brainstem, making a little nice with your nerves after you've stressed them out and irritated them. And then you come in, and usually people have very tense, clenching jaws. We call this trisomus with TMJ patterns. And you can just kind of rub your jaw. Same thing, 10, 15 reps, gentle massage. If any of this hurts, don't push so it hurts. Very light. And at the end, you open your mouth. And you get a little bit of a stretch there and just kind of cue all that in. Same kind of thing as a prior exercise, giving some inputs into your brainstem nerves, allowing that light switch reset to pull you out of that state of stress and make you feel better. And now you can regulate these nerves. Instead of going downstream for the cause, like going in and beating up muscles and doing all that, let's treat the cause, which is the nerves, and going to that middle brain and brainstem and making you feel better. Hopefully you find this helpful for you and any family members, and if you enjoy this video, please share it. Thank you for watching.